Happy New Year, everyone. So I just wanted to give you some outlines of what to do if someone's having a panic attack, because so many people suffer from them. Many of you may know, some of the symptoms for panic attacks can be someone's heart starts beating fast, they're trembling, they've got chest pain, they might feel nauseous, dizzy, completely confused about what's going on, chills, fear of actually dying, and just really high anxiety to the point they're becoming into a state of panic. The average panic attack lasts between 5 and 20 minutes. So I just wanted to give you a few tips of what to do if you come across someone or you know someone that is going into a panic attack or is having a panic attack. So the first thing to do is not disregard that it might be a physical condition. So someone might having these sort of symptoms might be having a heart attack, might having a stroke, might having an asthma attack. And if that is the case, you obviously need to phone 112 or 999 in the UK and get professional help. And if there's any doubt in your mind, phone to get help from an ambulance. If you are sure it's a panic attack and you think you might be able to be in a place to be able to help that person, first of all, check in yourself, check you're calm, you're not anxious. If you're in a state of anxiety as well, you will actually just heighten their anxiety. So find someone else if you don't feel you're in a place to be able to help that person. So one thing that I think is quite a good idea is to first try and sit them down on the floor so they don't have a fall, and tell them that it's going to pass. As I said, it's 5 to 20 minutes that they need to get through, and you need to say that this is going to happen and it's going to pass and we're going to get through it together. Another tip is to try and get them away from their irrational anxiety that's going on inside their head and think back to the rational mind. An idea is trying to get them to count things. So it might be counting how many people walking past with red shoes, how many tiles there are where they're sitting, sensory things, how many car horns they can hear, counting them and just getting through back to a rational, calm sense of mind. The issue of breathing is really important. A lot of people think to try and help someone with their breathing is a really good technique to help people get through a panic attack. You should only try and help someone with their breathing if you know them and you know they use a breathing technique to help themselves. Otherwise, the recommended advice is to not to encourage them to concentrate on their breathing, because that actually might just make them feel more anxious about not being able to breathe properly. The other sort of myth about plastic bags or paper bags, to believe into a paper bag, that's completely not the recommended advice now. And usually most people have a plastic bag, which is actually the worst thing you can do for someone who might be hyperventilating or having a panic attack. So no paper or plastic bags, and trying to just get through it with them by thinking of rational thoughts. When you get to the end of the panic attack, which, as you know, and that person, you have to encourage that person to know that they will get through to the end. Encourage them to talk to you about it if they feel comfortable at that point, and ask them if they've been through these sort of things before, whether they should get some professional advice. And in the article in Spain Someone, there should be a link to some professional ideas and advice. And always the first port of call is going to your GP or to find professional medical advice. So I hope that might help. There's a lot of people who go through panic attacks, so you're likely to come across someone at some point, whether it's young people, children, adults, old people. So I hope that was useful. Okay, Happy New Year, bye.